Tim, we've just been through your subjective assessment. You've been telling me about some problems you've been having in your left hip and knee regions. What I propose we do today for the rest of our session is we have a bit of a look at those, look at the muscles, see how your range of motion is. It'll involve 3 different tests. If at any point that's uncomfortable, I want you to let me know. What we'll do for these tests is I'll get you to do some on your own, then I'll have a measure, and then for some I'll apply a bit of overpressure, which just will require me to put my hands on you a little bit just to stabilise, so I can get an accurate reading of how your muscle length, strength and range of motion is in those areas. That'll just help me be able to prescribe future things and isolate problems, so we can move forward and help you to not feel any more symptoms. Before we begin today, do you have any questions?
No.
No? Yeah, and I have to check, do you have any previous health conditions, any recent surgeries,
No.
broken bones, anything like that? No bone conditions?
No.
Any family health problems I should know about?
Don't think so.
No? Okay, so do you understand everything we've gone through today?
Yes.
Yep, and you don't have any more questions after that?
No.
No, okay, so do I have your consent to proceed?
Yes.
Okay, perfect.
Please.
Okay, so Tim, before I get you on the plant, I'm just gonna chuck a bit of hand sanitizer on, check that the bed brakes are on. Yep, it's all good on that side. It's all good on that side. Okay, perfect. What can I get you first to just sit on the bed? I'll just come around and explain what we're going to be doing to start with, and then we'll get into some exercise. Okay, thank you Tim for lying down. What we're going to do for this first one is test the range of motion in your hip extensors. So what I'm going to get you to do for this one is, starting with your right side, what we're going to do is we're going to get you a hip and you'll just go back as far as you can, extending it out, trying to keep your leg reasonably straight, but it doesn't matter if there's a little bit of a bend. So we'll start with your right side, just go back as far as you can into that extension for me, whenever you're ready. Okay, good, have a look. Yep, and this time I'm just going to have a measure. So I'm just going to get you to do the same thing again, except this time I'm going to be using the goniometer, and whenever I say just be ready, alright, go. Same movement. Okay, perfect. Up to 40 degrees on that one, so that feels like a pretty good hip extension, range of motion. So this time we're going to do the same thing on your left side, which is your affected side. Of course, you said you've been having some problems on this area. Please let me know if there's any pain, any discomfort, anything like that doesn't feel normal. Sorry, and just let me know as soon as you feel a bit of that pull, bit like you can't go any further. Alright, I'm just going to watch you for the first time do that. And whenever you're ready. Perfect. And this time I'm just going to have a measure. Okay, any pain or discomfort in that one?
No.
Okay. Just bring it back down for me. Sorry, it wasn't quite ready yet. And then, whenever you're ready, I'll get you to do that same motion again, extending out. Okay, beautiful. Got to about 38 degrees, so fairly similar to the other side. And that just tells me how much range of motion you've got around there, how much that'll be impacting your daily life. What I'll get you to do now is just sit up for me. This time I'm actually going to have you lying on your back. So I'm going to grab you a pillow to put underneath your head just so you're nice and comfortable. Just grab that. For this test, what we're going to be doing is testing the length of your hamstrings. So for this one, what we do, you might have done some hamstring work before, might have used your hamstrings. We're going to be doing the opposite, so we're going to be stretching them in the other direction just so we can see the length, determine everything's all good and pinpoint any specific areas to work on. I'll get you to lie down for me, just on your back. Thank you. You're comfortable there? That feels all good? Yep. Okay, for this one, I'm going to get you to bring your hip up to like a 90 degree and knee up to a 90 degree. And then from there, I'm just going to put my hand under here and I'll help you to extend your leg up as much as you can. Is that alright with you? Yep, okay, I'll just bring this leg back up to the 90 first. Alright, whenever you're ready, we'll go up. Alright, how are you feeling there?
Yeah,
Bit of a stretch?
Yeah.
Okay, do you mind if I put a little bit more pressure on?
Yeah, put a bit more pressure.
Perfect. Okay, how's that? Any discomfort there?
No, that's all good so far.
Okay, we'll bring that one down. So that one's your right leg. So no unusual pain or discomfort in that one?
No.
Okay, perfect. What we're going to do for this one is I'm going to do the same thing again, just have a measure, see where we're at.
Yeah.
Okay, so I get you to bring that leg up. Perfect. And then I might use this one actually, that might work a bit better.
Yeah.
And then what I'm going to do, I'll help you and just to bring your leg up as much as you can. Okay, bit of a stretch there.
Yeah.
Can I go push a little bit further, do you reckon?
Yeah, a little bit.
How's that? Bit of a stretch there?
Yep, that's good.
Yep. Okay, let's see what we've got. That's about 60 degrees on that one, so it's how much your hamstrings are able to move and your everyday life. This time I'm going to do the same thing on your left side. Of course, pain or discomfort, let me know straight away. If anything feels abnormal, also let me know. So just bring that one up first. Yep, and then I'll help you to stand out. Okay, how's that? Bit of a stretch there?
Yeah, that's pretty good.
Yep. Bit of pressure.
Yep.
Bit of a stretch.
Yeah, that's good.
Any pain or discomfort, or just that bit of a stretch at the end of the
Just a stretch. Yeah.
Okay, this time, yep. Gonna do the same thing, have a measure. I'll just get you to bring that knee up again for me, if that's alright.
Yep.
Thank you. And then, ready, and go up whenever you're ready. I'll provide you a bit of support up here. How's that? Any pain or discomfort in that? Just a bit of a stretch?
Just a bit of a stretch.
Yep, a little bit more pressure if that's alright.
Yep, that's good.
Okay, perfect. Lower you back down for that one. And that one is about 50 degrees.
Yep.
So fairly even to the other one.
Yep.
A little bit less, but that's to be expected because of the pain you've been complaining of.
Yep.
For this last test,
Yep.
okay Tim, you're doing great. For this last test, what we're going to do is we're going to assess the strength of your muscles, specifically your hip flexors.
Yep.
For this test, what we're going to do is first I'm going to get you to just bring your leg up for me, your right leg up to a 90-degree flexion.
Yep.
I have seen that you can do that assisted just a second ago, but I'll just see it again, just whenever you're ready. Perfect, that's on your right side, yep. And bring it back down, relax for me. Yep. And go on your left.
Yep.
Perfect, relax for me. Any areas of discomfort there?
No, feels good.
Feels all good? Okay, for this one I'm going to get you on your right side, of course, first. Get you to do the same thing, just this time I'm going to apply a little bit of pressure.
Yep.
I'll start fairly moderate, and then if you can resist that pressure, I'll put a little bit more on.
Yeah.
So what I'm going to do is I'll get you to bring your leg up. If that's alright, I'm just going to put my hand on your thigh, and don't let me push your leg back down to the plinth, okay? Keep your leg up. Okay, a little bit of pressure there, a bit more moderate. Okay, that's good. Relax that one for me.
Yep.
Did that feel all normal going through that motion? Yep. Alright, now bring this one up for me, same thing. I'll put my hands here and I'm just going to apply a bit of pressure, see if you can resist that. Good, bit more. Okay, good, and just relax back down for me. You can sit up if you'd like, that's all of our testing done for today. That'll just help me get a closer idea of the specific problems that you're facing and where we can go next.
Yep, sounds good.
Perfect.